Hello there, are you in for your cranial nerve exam today? Great, I'm Dr. Nicola and I'll be carrying out your exam. Before we begin, I will have to go through some personal details with you, so please could you confirm your full name, date of birth, first line of your address, postcode, and finally your contact number. Excellent, you are now all checked in, so we can start the exam. As you can see here, this is my paperwork that I'll be working through today, and each section is on a different nerve. Okay, so we're going to start on the olfactory nerve, which is your sense of smell. So if you could take a nice big sniff for me, and now get one of those tissues and give your nose a really good blow. A little bit better than that. Come on, nice big blow. Perfect, well done. Okay, so this is the first scent, but I will need you to close your eyes. Thank you. Take a nice big sniff. What do you think? Nearly. Yes, lemon. Well done. Got there in the end. Okay, next one. Okay, nice big sniff for me. Yep, eucalyptus. An easy one. And this one. Let's take a sniff. Yes, lavender, well done. You can now open your eyes. Thank you very much. So that is your sense of smell complete. We're now going to go into the optic nerve, which is your vision. Okay. I'm going to start off by having a look in your eyes. Okay. I need you to look straight ahead at my nose or either at the back wall. Okay. Nice and still for me. Can you look that way for me? That way. Up. Down. And back at me. Good. Keep looking straight ahead. Wonderful. Good. Good. Eyes nice and healthy, which is really, really good. Thank you very much. Okay, now we're going to do the eye chart. So what I need you to do is just have a look here, and if you can read from here down to this row here. Okay, wonderful. Now if you can tell what letter that is. That. Don't worry if you can't see them, you know, you've done your best. Okay, and what colour is this and this? Excellent, thank you very much. Perfect. Right, we'll start with these, I think. Right, so we're going to have a look at these. As you can see, these circles, they're speckly circles, we have numbers in them. I'm just going to point to them, if you can tell me what they are. Fantastic, well done. And this one, same again, please. Thank you very much. And another eye chart in colour. I'm going to get you to read here to here, please. Wonderful. Can you tell what letter that is? Fantastic. What colour is this? This. Great. Now it's tell me the colours. Yep. Yep. Fantastic. Nicely done. What colour is this? Good. Now you can see these amazing toys, which are fantastic. They have different colours, as you can see, but I need you to tell me what colour they are. All right, so I'm going to point to a row, And if you can please just tell me what colour that row is. Okay, are you ready? Wonderful. Okay, so this row, that one, that one. Fantastic, well done. This one's going to be a little bit more tricky because there's lots of different colours. So here, that one, that one. Great. And finally, this one. Okay, these are quite pastel-y colours, but if you can just tell me the actual colour they are, that'll be great. Okay, so this one, that one, that one, that one, and that one. Good. So this one, that one, this one, that one, that one, that one. Fantastic, well done. Fantastic, very pleased. Okay, are you feeling all right? Good. What I need you to do now is look at my nose, and look at nothing else. Put my hands here. I need you to tell me which side you saw move. Good. Perfect. Move position. Good. Position. Perfect. And another position. Good. And final position. Wonderful. You did really well at focusing on my nose there. That's really, really good. What I need you to do now is look at my nose, and I'm going to put my fingers here and I'm going to move them away. I need you to tell me when you can't see them no more, but you need to keep focusing on my nose. Okay. Good. Now. Good. Good. Wonderful. Now I'm going to go up. Perfect. And now down. Great. Feel okay? Good. Again. Wonderful. Again. Final ones. Up. And down. Perfect. Did really well at focusing on my nose. What I need you to do now is basically the same again, but we're going to go the other way. So I need you to tell me when you can see it. Okay, ready? Go. Good. Perfect. Good. Yep. I love it. Well done. Great. Perfect. Feeling okay? Really good job there. I feel very happy with your vision. Now we're going to move on to the trochlear nerve and the abducens nerve, which are both based around different eye movements. Okay, so this is the list that I'm going to be working through. So what we're going to do first is start by following the light. Okay, so if you can look straight ahead on my nose, and I'm going to move the light. I need you to just look at the light with your eyes. Don't move your head. Can you do that? Great. Let's start at my nose and go. Okay, do as best as you can. Okay, if it goes off vision, don't worry about it. Okay, you're doing really well. Good. So keep looking at it. Doing well. Good. Follow the light. Keep following the light with your eyes. That's as best as you can. Good. Fantastic. Same again, but with my finger. Follow my finger. Good. Keep following. Don't worry if it goes out of focus. Just with your eyes. There we go. Well done. Doesn't matter what position it goes in, just follow the finger. Good. Good. Perfect, doing really well here. Okay. Perfect, please stop. Okay, what I need you to do now is look at the light, then my nose, okay? Light, nose. Ready? Light, nose. Light, nose. Perfect, well done. Now we're going to look at my finger and do the same. So we're going to do light finger, light finger, light finger. Good. Perfect. Great. Different position. Same again. Light finger. Good. Don't worry if it goes out of vision. Good. Wonderful. Please relax for me. What I want you to do now is look at my nose and look at my finger. Nose, finger, nose, finger. Go. Nose, finger, nose, finger, nose, finger. Good. Perfect. Well done. What I'm going to do now is a little bit tricky. We're going to do finger, nose, finger, but I'm also going to distract you with a light, okay? See what you can do. So you don't want to look at this light. Nose, finger. When you're ready, nose, finger. Good. Nose, finger. Don't get distracted. Good. Don't look at the light. You're doing really well. Very impressed. Perfect. That was brilliant. Well done. Very pleased. I've nearly lost my pen light. Okay. Could you wink for me? Yeah, wink. And with the other eye, wink, 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 wink. If you can do that for me. Wink, 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 wink. One wink. 1, 2, 2. Great, perfect. Now can you blink for me? Yep, blink. At the same time, yes, blink, blink, blink. Do it really fast. Blink, 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 blink. Great. Slow it down. Do blinks. 3 blinks in a row. Great. Now 2. Good. 4. Perfect, perfect, perfect. Last go. 2, 1, and 3 blinks. Excellent, well done. Movement of the eyes are great, not a problem there. Fantastic. Wonderful. Don't worry, that's the first bit done. We're moving on to the second bit now. Now, this is called the trigeminal nerve, okay, which is the feeling in your face and mouth. So as you can see here, this is a nice long list, and we're going to start by feeling your face. Okay, are you all comfortable? I hope you're comfortable. Please feel free to just look straight ahead and just let me get on. Just having a feel on your face right now. Okay, that's good. Doing well. Can you feel everything I'm doing? Good. Perfect. You can close your eyes for me. Feel that? This? Perfect. Keep your eyes closed for me. Good. Okay, just feel around the face. Okay. Just feel the forehead, brow area. Feel all that? Perfect. Excellent. Feel all that? Perfect. Well done. Okay, next one might look a little bit scary, but it's not. Okay, so I've got this lovely little hammer here, okay, and what I'm going to do is just gently touch different areas of your face, okay. Okay, just relax for me. Good. Feel that okay? Perfect. Feel that okay? Good. Still okay? Great. Wonderful. Your lips, chin, upper lip. Great. Felt all that all fine? Right, now, bigger one. Feel that? Excellent, well done. Now we've got an even scarier looking device. So this is a sharp, spiky roller. And I'm not going to dig it deep into you, don't worry. But what I need you to do is close your eyes for me, and I'm going to gently roll this over your skin, and I want you to tell me if you can feel it and if it feels sharp. Okay, we'll start on your chin. Yeah? Okay. Right, now I'm going to bring it a little bit closer in. Okay, feel that? Good. Okay, down your nose. Perfect. Does that feel all right now I'm touching? Okay. Down your nose again. Touch. Again. Touch. Right, can you tell me which one's the spikes and which one's my hand, okay? Good. Good. Perfect, well done. You can open your eyes. Okay. Right, I have a little Q-tip. What I'm going to do is literally touch your face with it. All right, so you can see this end is pointy, that one's round. So just look at me first. I'm going to go on your nose. Point, round. Can you feel the difference? Great. What I need you to do is just tell me if it is pointed or round, and I need you to close your eyes. Thank you. Yep. Excellent. Good. You're doing really, really well. Perfect. Perfect. Good. Great, you can open your eyes. So you could feel all that, and you can clearly feel the difference, which was great. Thank you. Okay, if you can look at me. Can you feel that? Good. Close your eyes for me. Good. Open them. Feel all that? Perfect. That? Good. Well done. As you can see, this side's fluffy and that side's quite hard. I want you to tell me if it's soft or hard. So close your eyes. Thank you very much. Feel the difference? Great. So what's this? Good. Great. Good. Perfect. Yep. Perfect. You can open your eyes. Well done. Excellent. Okay, now I'm going to have a look inside your mouth. All right, so what I'm going to do is just sanitize my hands. Okay. Excellent. Okay, we've got several different things to do with your mouth. The first one is I'm just literally going to feel inside your mouth. All right, so you can open wide for me. Thank you. Just feeling your tongue. On the top of it. Okay, yeah, the sides of it. Good. The tongue up for me. There we go. Feel underneath. Do you ever get any ulcers? Okay. Put your tongue back. Now I'm going to feel the inside of your mouth. On that cheek. Okay, the other cheek. Another roof of your mouth. And you're doing very, very well. Okay, good. I'm just going to feel around your teeth. And the bottom. Perfect. You can relax for me. Right. Now I'm going to touch your tongue with this. All right. So if you can open your mouth for me, but keep your tongue in. Feel that? That. Okay, as you can see the difference, can you tell me which one is round or pointed? Okay. Good. Excellent. Now if you can pop your tongue out for me and same again. Rounded or pointed? Good. Good. Excellent. You can relax. Thank you very much. Right, I now need you to chew for me, just like you're chewing. Yep, good, keep doing that. I'm just going to hold, keep chewing, keep chewing, keep chewing. Stop, great, open your mouth, close your mouth. Open, close, open, close, open. Okay, do it again. Open, close, stop. Fantastic, well done. Now I need you to bite down for me. Like so. And again. Fantastic. Well done. Right, we're now going to move on to the facial nerve, okay, which is also about taste and face muscles, okay. So we're going to start off with the taste first. We have 3 things to taste. And I need you to tell me which one is bitter, sour or sweet. Can you do that? Good. So let's start with the first one. I don't want you to tell me what it is. I just want you to tell me if it's sweet, bitter or sour. Okay. Open your mouth. Sweet, bitter or sour. Okay. Next one. Okay, open wide. Sweet, bitter or sour. Okay. And next one. Open wide. Okay, sweet, bitter or sour. Excellent, well done. Okay, can you smile for me? Nice big smile. Okay, smile with your teeth out. Okay, now just show me your teeth. Go on. That's it. Good. Perfect. Relax. Okay, if you can puff your cheeks out for me. Okay, suck them in. Good. Relax. And can you raise your brows for me? Hold them. Down, up, down, up, down, up, down. Great. Now frown. Brilliant. Thank you very much. It's looking really good. Okay. Now, what I need you to do is do a little bit of a hearing test. So we're going to cover the acoustic nerve, okay? So, first things first, I'm going to get you to close your eyes and I'm going to pop my fingers either side of your ears and I would like you to tell me which side you heard move. Wonderful. Excellent, well done. Now I'm going to get out my tuning fork. Okay. You hear that? That. Okay. Wonderful. Can you hear that? Okay, that, and that, that, that. Okay, do that again. How's that sound? Good. Okay. Can hear it. Okay. Good. What I would like you to do now is tell me if it's close to you or further away. So if you could close your eyes for me. Good. Good. Excellent. Keep your eyes closed for me. Good. Excellent. Well done. Keep your eyes closed. You hear that? Good. That. Great. Well done. You can open your eyes for a second. Now, what I have here is a tuning fork set. So as you can see, there is different sizes. Okay, so I'm going to try this one. Hear that? Okay. Good. Okay, now what kind of sound is it? How does it compare to the last one? Fantastic, well done. You can open your eyes. So you've got very good hearing, well done. Excellent. How are you feeling? Great. Doing really, really well. A few more things left to do. Okay, so Wonderful. Just mark that off. Right, now we're going to go on to the vagus nerve, which is all about swallowing, taste and speech, okay? So stick your tongue out and say ah, good. Open your mouth and say ah, good. Open your mouth and swallow, good try. Okay, repeat the words, coconut, chocolate, honey, dog, cat, personal. Coconut, chocolate, honey, dog, cat, personal. Faster, come on, brilliant. Now whisper it. Coconut, chocolate, honey, dog, cat, personal. Coconut, chocolate, honey, dog, cat, personal. Great, speed it up, brilliant. Copy the sentence. I need to find some time for myself. I need to find some time for myself. Great, pick it up, perfect. Now whisper it. I need to find some time for myself. I need to find some time for myself. Yes, great, perfect, stop. Last thing I want to do is get you to open your mouth for me. I'm going to pop in this depressor and I'm going to press down. Try to raise your tongue for me. Okay, that's great. Say ah, perfect. I'm going to move this back now to get your gag reflex to work. Okay, brilliant, well done. Thank you very much. Fantastic. Right, I'm now going on to the accessory nerve, which is all about movement, okay? So if you can shrug, both shoulders, great. One shoulder at a time, great. Arms out for me, arms back, arms out, arms back, out, great. Up, down, up, down, up, down, okay? Down to the floor, back up, down to the floor, back up. Great, perfect, thank you. Good. What I want you to do is turn your head for me. So left, right. Good. Up, down, up, down. Do it quick. Up, down, left, right. Do it. Great. So the chest, hold it. Back up, hold it. Left, hold it. Right, hold it. Can you do that? Perfect. Thank you very much. Can you rotate your head in a full big circle for me? Right the way around. Okay, and back the other way. Wonderful. Okay, what I need you to do is let me pop my hands on your shoulders. Thank you. And I'm going to push down. You're going to push up. Try to resist it. Fantastic. Well done. What I need you to do now is give me your hand. Squeeze. Great. The other one. Squeeze. Great. Both at the same time. Squeeze. Great. Release. Thank you very much. Your hand on mine like so. We're going to push against each other to find some resistance. Got it? Brilliant. And the other side? Brilliant. Now both at the same time. Brilliant. Thank you ever so much. Fantastic. Finally, I'm going to hold your head, and if you can, try to move it up for me. I'm going to try and hold it. Brilliant. Down. Good. Now I'm going to go to the left. Try to hold it. Great. Now the right. Fantastic. Well done. Right, final nerve we're checking is the hypoglossal nerve, which is all about tongue movement. Okay, right, so what I can get you to do now is stick your tongue out for me. Great, and back. Now I want you to curl your tongue. Good try. Rotate your tongue, this is going to be quite difficult. Good try. Okay, put your tongue in your cheek. And the other side. Perfect, thank you. Tongue to the roof of your mouth. Great. Can you wiggle your tongue for me? And pop it out a little bit and do the same. Okay, thank you very much. Now, this might be a tricky one. I want you to stick your tongue out and try to speak. So just say anything that you want to say, politely. Not bad try. There's some tissue down there to bring this out. Thank you very much. That's absolutely fantastic. Well done. Right, now I'm going to move on to a reflex test. Okay. Right. Right, I'm going to start with your knees. Okay, if you just sit there and hang them over. Thank you very much. And you can relax for me. Okay, again. Good. This one. One more time. Perfect. Thank you very much. Okay, now I'm going to move on to your elbows. All right, so leave your arm there for me. Thank you. Again. Good. Other side. Fantastic. Now going down to your wrists. Okay. Good. Other side. Perfect. Now I'm going to do your ankle. Achilles. Keep your foot there, thank you. Good. Other side. Good, well done. Now I just want to get this one. Okay, elbow. Okay, that's fine. And your ankle. Great. Fantastic, thank you very much. Right, what I'd like you to do now is just give me your foot, pop it there on my leg for me. Okay, I'm going to use this sharp point on your foot. I want to see the reaction. Okay, right, there we go. How's that feel? Okay, just do lines down your feet. Ticklish. Now I'm going to pop it between your toes gently. Now I'm just going to tap the bottom of your feet. Feel all that? Okay, and the other side. Okay, so there's that side and then that side. That's good. Pop your foot down. And this one, thank you very much. Okay, so feel that. Okay, how does it feel? Same. Great. To your toes. Fantastic. Now I'm going to tap your feet. How's that? And the other side. Fantastic. You can now relax. Right, okay, I'm going to just do a little bit of coordination. Right, if you could close your eyes for me, I need you to quickly touch something that I say. So if I say touch your finger, okay? Right, are your eyes closed? Good. Right, touch your nose. Okay, head, nose, knee, nose, elbow, head, bum, knees, wrists. Perfect, you can open your eyes. Thank you very much. That's your examination complete. I'm pleased to tell you that all your cranial nerves are working perfectly, and so are your reflexes, and so is your coordination. Do you have any questions for me? Okay, that's great. What I'll do is I'll write up the report and I'll send it to yourself and your doctor. Is that okay? Brilliant. Well, thank you for visiting, and you take care now. Bye-bye.